Welcome to Copilot Podcasts.
You know that feeling when you're drowning in paperwork at 8 p.m., still typing up patient notes from your morning sessions? Well, what if I told you that's about to become as outdated as paper charts? Today, we're diving into how AI tools are transforming family practice and internal medicine. By the end of this episode, you'll understand the real-world applications of AI in primary care, the tools that actually work, and how they're changing the game for physicians and patients alike. And it's not just about saving time, though that's huge. We're seeing AI reshape everything from diagnosis to documentation, and the results are pretty remarkable.
Let's start with something that caught my eye. According to recent studies, primary care physicians would need 27 hours per day, 7 days a week, to properly care for a panel of 2,500 patients. That's obviously impossible.
Yeah, that statistic really highlights the crisis we're facing in primary care. And it's exactly why AI tools are becoming so crucial.
So what are some of the key ways AI is helping address this impossible workload?
Well, one of the biggest areas is documentation. According to recent data, for every hour of patient care, doctors typically spend 2 hours on documentation. But now we have AI tools like Dragon Ambient eXperience that can automatically convert patient conversations into medical documentation.
That's fascinating. What kind of impact are these tools having?
The results are pretty impressive. Physicians using these AI documentation tools report a 70% decrease in feelings of burnout and fatigue, and 79% better work-life balance.
Those are significant numbers. But I have to ask, are there concerns about accuracy?
That's a really important question. The key thing to remember is that AI programs are only as good as the data they're trained on. They can sometimes create what programmers call hallucinations, essentially false information.
Hallucinations? That sounds concerning.
It can be, which is why it's crucial to choose the right tools. For instance, some apps like Pathway are specifically trained on peer-reviewed journals for clinical questions, making them more reliable for medical information.
You know, it reminds me of having a really knowledgeable colleague always available to consult, but one who needs to be fact-checked occasionally.
That's actually a great analogy. And speaking of colleagues, there's some fascinating research from Stanford showing how AI can complement physician expertise in diagnosis.
Tell me more about that research.
Well, they found that ChatGPT-4 achieved a median diagnostic score of 92, essentially an A grade, while physicians scored around 74 to 76, with or without AI assistance.
Wait, the AI outperformed the doctors?
In terms of comprehensive diagnostic reasoning, yes. But here's the interesting part. Even when physicians had access to AI, their scores didn't improve significantly.
That's not what I expected. What does that tell us?
It suggests we need better training in how to effectively collaborate with AI tools. It's not enough to just have access to them. We need to learn how to integrate them into our clinical reasoning process.
You know, it's kind of like when calculators first came to schools, having them wasn't enough. We had to learn how to use them effectively.
Exactly. And just like calculators didn't replace the need to understand math, AI isn't replacing doctors, it's augmenting their capabilities.
Let's talk about some specific tools. What are some of the most promising AI applications you're seeing?
Well, there are several key areas. First, there's risk prediction and intervention. AI can analyze EHR data to predict things like hospital readmissions or potential complications.
That sounds incredibly useful for preventive care.
Absolutely. Then there's population health management. AI helps identify care gaps and optimize performance with Medicare quality payment programs.
How about direct patient care? Are there AI tools for that?
Yes, there are AI systems for medical advice and triage that can help manage common symptoms, freeing up appointments for more complex cases.
But doesn't that risk missing something important?
That's why these tools are integrated into team-based care models. They're not replacing physician judgment, they're supporting it.
You mentioned chronic disease management earlier. How does AI help there?
This is where it gets really exciting. AI can analyze data from wearable devices and IoT sensors to monitor chronic conditions in real time.
Like what kind of monitoring?
Well, imagine a smart inhaler that could predict an asthma attack before you even feel the first wheeze, or continuous glucose monitoring that adjusts insulin recommendations in real time.
That's incredible. It's like having a 24/7 health monitor.
Exactly. And these tools are getting more sophisticated. Some can now detect patterns that might indicate early signs of heart disease or diabetes years before traditional diagnosis.
But with all this technology, aren't we losing the human touch in medicine?
Actually, it's quite the opposite. When implemented well, AI frees up physicians' cognitive and emotional space to focus more on personalized patient care.
Can you explain what you mean by that?
Think about it. If AI is handling routine documentation and basic triage, doctors can spend more time actually connecting with their patients, understanding their concerns, and developing personalized treatment plans.
That makes sense. It's about using technology to enhance human interaction, not replace it.
Exactly. And we're seeing this in the data. Practices using AI tools effectively are reporting both better patient outcomes and higher physician satisfaction.
Let's talk about implementation. What should practices consider when adopting these tools?
The key is to start with clear goals. Are you looking to reduce documentation time, improve diagnostic accuracy, better manage chronic conditions? Different tools excel at different tasks.
And I imagine training is crucial.
Absolutely. Remember that Stanford study we mentioned? Having AI tools available isn't enough. You need to train staff to use them effectively.
What about cost? These tools must be expensive.
There's definitely an investment required, but many practices are finding the return on investment significant when you consider the time saved and improved outcomes.
Are there any particular success stories you can share?
Well, one study found that practices using AI documentation tools reduced their documentation time by 50% on average. That's hours of time given back to physicians every week.
That's substantial. What about patient acceptance? Are they comfortable with AI being involved in their care?
It varies, but most patients are surprisingly accepting when they understand that AI is supporting, not replacing, their doctor's judgment.
And security, that must be a major concern.
Absolutely. Any AI tool used in healthcare needs to be HIPAA compliant and have robust security measures in place.
Looking ahead, what developments are you most excited about?
I'm particularly interested in the integration of quantum computing with medical AI. This could revolutionize how we process vast amounts of medical data.
That sounds like science fiction.
It does, but so did many of the AI tools we're using today just a few years ago. The pace of innovation in this field is incredible.
Any final thoughts for practices considering AI adoption?
Start small, focus on one area where AI can make a meaningful difference, and make sure to invest in proper training. It's better to do one thing well than try to implement everything at once.
That seems like solid advice. Any potential pitfalls to watch out for?
The biggest one is probably over-reliance on AI. These tools should augment clinical judgment, not replace it.
So it's about finding the right balance.
Exactly. AI should enhance the human aspects of medicine, not diminish them.
Well, as we wrap up today's episode of Copilot Podcasts, what's the one thing you want our listeners to remember?
That AI in medicine isn't about replacing doctors, it's about giving them superpowers. The ability to process vast amounts of data, predict outcomes, and spend more time on what matters most, caring for patients.
And remember that 27-hour day we talked about at the beginning? Maybe with AI, we can finally make those impossible demands of primary care a bit more manageable.
That's exactly right. The future of medicine isn't about choosing between human touch and technology. It's about using technology to enhance our human capabilities.
Thank you for joining us today on Copilot Podcasts. Remember, the next time you see your doctor typing away at their computer, they might just be getting a little help from their AI assistant, and that's a good thing.